Day, Hospice Buffalo is hosting a free community screening of the PBS Frontline documentary Being Mortal on Wednesday, April 19th at the Mitchell campus in Cheektowaga. It underscores the importance of people planning ahead and talking with family members about healthcare decisions. So here to tell us more, so we have Dr. Megan Farrell, who is the medical director there, and Kelly Clem, registered nurse and VP of Clinical Education and Patient Advocacy. Good morning, ladies.
Good morning.
Thank you for coming to talk about this very important opportunity for people. If a loved one is faced with a serious or life-threatening illness, the best time to learn about your healthcare options is before you're faced with a medical crisis. And unfortunately, the vast majority of us do not talk to family members about this.
True. I think, the hardest thing is the conversation. And people have to have a level of comfort and be prepared to talk to their loved ones so that they really have a true understanding of what's meaningful and what's important to them as they make these critical decisions.
Right, and Kelly, that's what this documentary is all about. It's people facing that, and hopefully it will spur dialogue with people.
Absolutely, and the vignettes that they show, they chronicle the lives of people at various points in their illness, and they show without saying. It's a natural progression of those who were prepared before and those who had an openness to changing their decisions, which is something that a lot of people don't realize. You can start out with an illness and say, I'm going to do this, this, and this, but as that illness progresses, those adjustments need to be made, and they need to be made with the support of the medical staff and with the family.
And unfortunately, let's just talk about this. 70% of people say, if I pass away, I'd like to do it at home, but you know what? Only, I guess it's 70% of us die in hospitals and institutions. It's not what we wanted to do. And a lot of times, by the time that decision has to be made, you haven't discussed it with anybody and nobody knows.
Right.
And that's what we're trying to dispel. That's why going and seeing something like this with your family will hopefully open that dialogue and say, I kind of feel like this guy. I think maybe this is what I want to do, and then move towards putting that down in writing.
Yes. One of the most important narratives in the film is Dr. Gwande's own personal journey with his father.
Yes.
So he and his family are walking through this with you, and it really reveals all the issues that a family can encounter.
And, why is it, Kelly, that we don't want to do this? Why is it that people think, oh, I can't bring this up with my mother, I can't bring this up with my father, I don't want to talk about it?
Exactly. I think when you're living your life and you're talking about spring, it's not on the forefront of your mind.
Right.
When the illness first approaches the family and they are left with the decisions early on, they don't want to take away hope. They look at this as, if we talk about that, we're like, making a taboo statement, or we're setting the stage for what might be. And that is typically not true. And it certainly puts the delay in that holding pattern on such a a unique, stressful point for people who want to talk about it.
Sure.
Most of the patients really do want to discuss this, but families think we don't want to scare them, we don't want to take away that hope, and then you're in crisis
You're right,
mode.
because then they'll think, okay, they already know what they want to do. That's it. And that's not it at all. What we want you to do is understand that this PBS documentary, Being Mortal, is going to be shown at 5:30 Wednesday, April 19th in the Education Center, on the Mitchell campus in Cheektowaga. But you have additional screening sites, and so this can be seen everywhere. And take a look. Here's where it's going to be coming up, and you're absolutely just free to go and sit and watch this, all right? But you can see how it's going to be all around Western New York, West Seneca, Cheektowaga, Buffalo in the coming months. And it's important. Being Mortal, it's a free film screening and discussion, because people have choices to make. If they can write down what they'd like to do in an advance directive, there's 2 versions of that, right? That you have choices about.
Some of the most important decisions are having the discussion, and in that discussion, you choose someone who can help you with the decision making, and if you are unable to voice your own decisions, someone to do that for you, a healthcare proxy. The choice of that individual is pretty important, and it need not be a family member. It can be a close friend, but it has to be someone will advocate for you and honor the wishes as you have outlined them.
And Kelly, we tend to start thinking about people who are elderly or people who are sick, but this is really something for everybody over 18.
This is because you never know what can strike, and you want to give that gift to your family members, and that's how we frame it. You know, to take away the burden of having to decide what to do, and to give them the gift of knowing that this is something that mom, dad, sister, brother would want. That takes so much pressure, and it allows those relationships to continue during that process, as opposed to struggling to try and figure out.
And over at Hospice Buffalo, is this what you've seen from people who have gone ahead and written this down, and now the family knows? What's it like after that? How do they feel?
I think it takes a considerable amount of stress and pressure off of the family. And you can reframe it for the family and say, you're not deciding these things, you're advocating for the person because the decisions have already been made. So it takes a tremendous amount of stress off of families.
Right. For somebody to say, this is, I know their wishes, instead of going through the rest of their life saying, I didn't know.
Right.
I'm not sure this is what they wanted, right? And that will stay with you for the rest of your life.
And what you find is that, you know, a brother and a sister might have completely different ideas about what mom wants. And so therein comes the struggle. If they can both say, well, it doesn't matter what we want, if we're on different sides of the page, we're both on mom's page. And that's really where you see the gift coming through.
If somebody, of course they're going to go and want to watch this, but if somebody said, you know what, we have to do this advance directive, how do people do that?
It's very simple. It's not a legal form. You can certainly solicit the assistance of an attorney, but it is a form that's available through your doctor's office, at hospice, in any hospital, and you simply identify the person that you would like to speak for you, and then an alternate in case that person is not available. Once that's done, everything that you want to have listed as far as medical interventions, hospitalizations, and the like can be identified there. There's also a MOLST form, which goes into a deeper categorization of all the things that you would want. And then you decide for yourself, as long as you can speak for yourself, you don't utilize the healthcare agent, but once you are unable to communicate your wishes, that person then steps in and speaks for you.
I'll tell you, it's a valuable time well spent seeing Being Mortal, 5:30 Wednesday, April 19th in the Education Center. That's the first screening. For additional screening sites, again, just contact hospicebuffalo.com/NHDD. We want to thank Dr. Farrell and Kelly Clem for being here this morning to talk about such important information.